We're out here today to bring awareness to the unfair rollbacks proposed by this UCP government and to highlight that the Sturgeon is not immune to the critical nurse staffing shortages that are plaguing this province. I want to thank my colleagues, both nursing and from other unions, who've come out to support us. We work as a team and their support means a lot to us. I've been a registered nurse for 21 years, the last 15 years at the Sturgeon, and closing 9 inpatient surgery beds is not a normal practice in the summer. We have lost numerous RN positions because of the race to the bottom practices such as operational best practices and vacancy management. We have lost frontline RN positions in the last couple of years in our ER, OR, surgery unit, IV clinic, and outpatient department. As nurses have left, positions are not filled. We currently have over 26 vacancies on site, resulting in critical staff shortages on some shifts. Nurses are tired. We've been working full out, short-staffed, extra shifts, overtime, mandatory overtime, and we're feeling depleted. We've given so much these past 16 months, and now we're being fed a narrative that is us, the frontline heroes, who need to pay for bad government policy and government debt. Like we haven't paid already with time away from our families, fear of catching COVID and spreading COVID in the early months, moral injury, and burnout. We want people to know their healthcare is at risk. Less nurses means less care for Albertans. At a time when we are critically short-staffed, chasing nurses out of the province, we shouldn't be closing beds across the province. We've lost at least 4 nurses to BC, Ontario, and the United States in the last couple of months at our site alone. We need this UCP government to recognize the importance of registered nurses, not with hollow words, but with action. Fair compensation and adequate staffing are crucial. We cannot afford to drive out another generation of nurses like they did in the 90s. Albertans deserve better, and so do nurses.
We have a backlog of Albertans with untreated conditions, and we have an exhausted healthcare workforce, and the response from Jason Kenney and the UCP is to threaten to cut their wages and fire up to 11,000 frontline healthcare workers. It is shameful. At a time when other large provinces are providing incentives for nurses to move there, Jason Kenney is determined to drive nurses and other frontline healthcare workers out of Alberta. That's a serious threat to the long-term strength of our public healthcare system and to the public healthcare itself, provided to our loved ones, to ourselves, to our kids, to our aunts, our uncles, and our grandparents. All of that is at risk because of Jason Kenney's strategy to destabilize our healthcare system.